Hello, my name is Haley Yates. Today my presentation is going to be on undiagnosed diabetes in our community. So first thing is we have to understand what diabetes is. So diabetes is a disease where a person is unable to control the blood glucose levels in their body. There are several different types of diabetes, more than what's listed here, but these are just a few. So first is type 1 diabetes. This is an autoimmune disorder where your pancreas is unable to produce any insulin and the patient has to be on insulin injections to help as a supplement. Type 2 diabetes is brought on from genetics and lifestyle choices. This is when either a person's pancreas is unable to make enough insulin or the body is not able to use the insulin that is made. Monogenic diabetes is a term used for diabetes that is an onset from one genetic mutation. So an example of a monogenic diabetes is neonatal diabetes. So this is diabetes in a newborn. Symptoms usually appear in the first 6 months of a child's life, and it's purely genetic. There's nothing to do with the child's intake. Gestational diabetes is diabetes that forms in the mother as she's carrying her young, and her body is unable to control the amount of sugar in her body. Usually after she gives birth, this type of diabetes does go away, but she is at risk for developing type 2 diabetes later. Next is diabetes, looking at it in our nation. So roughly 34 million people in the US have diabetes. 25% of the people with diabetes are unaware that they have diabetes. 90% of diabetic cases are type 1 or type 2. So those are the two that we're really going to be referring to in this PowerPoint. And 1 in 11 people are living with diabetes. Okay. So diabetes in our local community, almost 58,000 Floridians are unaware that they're living with diabetes. 13% of the population has diabetes. And Volusia County's health assessment for 2020 recognizes diabetes as a health crisis and that's something that needs to be addressed. All right, so some risk factors for developing diabetes: being over 45, having a family history, being overweight, sedentary lifestyle, smoking, blood pressure too high, poor diet, high cholesterol, all things that can help contribute to your body developing like a type 2 diabetes. Okay. Next are signs and symptoms. So increased hunger and thirst, increased urination, sugar in the urine, chronic fatigue, blurred vision, slowed healing, nerve damage in your peripheral, and uncontrollable weight. So when your physician does suspect that you have diabetes, there's a series of things that they're going to do for you. First, they're usually going to do a finger stick, which is taking an accurate in the moment blood sugar level for you. And based off of that, they can choose to do a urinalysis as well, looking for that sign and symptom of sugar in the urine. If both those come back as concerning, your doctor is then going to send you to do an A1C blood test. So the A1C blood test I've explained over here is an average of your blood sugar levels for the last 2 to 3 months. And usually you're going to take this test once and then you'll take it again in 3 months. And then your doctor will then diagnose you with diabetes dependent on those results. So they have like a scale for stable, pre-diabetic, and diabetes. So the higher percentage of your A1C is going to place you in either category. Okay. Just want to give you some numbers for sugar levels. So stable is less than 140 milligrams per deciliter. Pre-diabetic is 140 to 199 milligrams per deciliter, and over 200 is going to be considered diabetic. Okay, so dangerous, it's We know that a lot of people are living with undiagnosed diabetes, and it's very dangerous because you can develop all these chronic illnesses, such as heart disease, stroke, kidney disease, the nerve damage like we mentioned, depression, high blood pressure, increased risk of dementia, and risk for early death. So some pretty serious problems. When you do get treated for diabetes, we can put you on medications such as metformin and injectable insulin to help manage your systems. But holistic options are available and oftentimes can help treat your diabetes. So weight loss, exercise, eating a healthy, balanced diet, making sure that you're avoiding carbohydrates is very important, and managing your sugar levels, your blood pressure, and cholesterol are all very important for helping aid those medications or help treating your symptoms as is. All right, so financial costs for diabetes. Florida spent $24.3 billion due to diabetes. Each year they spend that. If you have diabetes, you're spending 2 to 3 times more on healthcare costs than anyone that does not have diabetes. And federal government does put a lot of money into trying to bring people awareness of diabetes and symptoms. All right, so as we know, a lot of Floridians and a lot of people in Volusia County are not being treated for their diabetes, and that's due to economics, poor health, education, and lack of attention to health. So in Volusia County, health education is not the #1 priority. I know growing up in Volusia County, a nutrition class wasn't required of me. So getting that health education is kind of pushed to the side, and there probably needs to be more of awareness of it. And then according to the health assessment for 2020, citizens of Volusia County have an "if it's not broke, don't fix it" attitude towards health. And 25% of citizens claim to have other issues that are more pressing. So other things are just more important to them than addressing their health issues. Lots of folks in Volusia County are living in poverty currently. And with increased health insurance deductibles and the cost of health insurance increasing in general, more folks are going uninsured and not getting the routine health care that they need. So in summary, diabetes is a major issue across the whole United States and all the way into our local community. It's very treatable. There are many options to help people, but sadly, due to healthcare issues and lack of time or attention to, people are not getting the help they need, which is leading to more healthcare costs and bad long-term chronic diseases for people. So this is an important issue that does need to be addressed in our community. And thank you very much for listening.